Good morning to you. It's Tamika Chambers here with another question from Nurses Labs. I like that resource because they give you quality questions with correct and incorrect rationales. So as you know, rationales can really help bridge the gaps in knowledge and application. So let's do this question. And as always, I recommend that you get a sheet of paper, something to write with, and write out your answer before the person gives you the answer and your rationale to see if you're thinking more like a nurse. You have just admitted a patient with bacterial meningitis to the medical surgical unit. The patient complains of a severe headache with photophobia and has a temperature of 102.60 Fahrenheit orally. Which collaborative intervention must be accomplished first? All right, so as you know, I encourage you to read it so that you make sure that you're in the habit of reading the question as it is. Paraphrase. How would you paraphrase this? What are your keywords in here, right? So I'm looking at bacterial meningitis, severe headache, photophobia, temperature of 102. Which intervention must be accomplished first, or should you do first, right? And then you're going to put yourself in the position of this nurse. Which intervention should I accomplish first? All right. So always looking at the relationships that are going on in here in this question. Do you administer codeine 15 milligrams orally for the patient's headache first, or infuse ceftriaxone, Rocephin, 2,000 milligrams IV to treat the infection, or give acetaminophen, Tylenol 650 orally to reduce the fever, or give Lasix, furosemide 40 milligrams IV to decrease intracranial pressure? Go ahead and select your answer, come back, and let's resume. I always say that if you get a temp of 101.0, that sends a red flag. We have a red flag going here. We're looking at symptoms, diagnosis and symptoms, and the relationship as to what should we do first. And when you think about bacterial meningitis, you don't want to just treat the symptoms. You want to get to the root of the issue. This is what we're talking about. What's the root? So if you administer codeine, that's getting to the pain, right? That's not saying that we're not going to do that, but what do we do first? Give acetaminophen. Again, that's talking about the symptoms. Give Lasix. Well, there's nothing in here about, swelling, but we know, eventually we will give that if there's issues with intracranial pressure. What you want to do is get to the root of it. You want to get that antibacterial medication on board so that you can go ahead and treat the issue, the root cause, right? So again, you look at your rationales. Pain medications can be given to help with fever, to help with pain, and we can definitely use Lasix to reduce CNS stimulation, as you see on this rationale. So I'm going to get out of that. And just to let you know, because I had several people to ask about how do you get this resource. And if you go here to Nurses Labs, you can see where it has exams, and you have several exams you can choose from to help you. And this is free, you guys, to help you practice on NCLEX questions, including IV rate rationales, rate calculations, diabetes, drug dose calculations. All right. All right, you guys, take care of yourself. Remember, you do have resources out there, and you can do it. I'll talk to you guys soon. Take care.